Hello, my name is Austin Schleit. This is my Foley insertion and removal video. Here's my ID badge. So the first thing I would do when entering the room is identify the patient using two identifiers, name and birthday. Then I would explain the procedure and why they're having this procedure. Then I would ask about any allergies or if they're having any pain, close any doors or curtains for privacy, and then perform hand hygiene. And then I would go on to my actual Foley insertion. So I would open up the bag, remove the items, use this bag as a trash bag for later. So I would first, front, side, side, front, or back, and then, so it's not hanging off the edge and touching my uniform, I would then turn it just a little bit. The next thing I can touch before anything in there is the drape. I would then open up the drape a little bit, only touching a slight bit of the sides, and put it next to my patient, shiny side down. So after that, all I can open is my gloves. So I have a different set of gloves than this one, so I will remove these sets of gloves and put in these sets of gloves and off the sterile field. Only touching the inner inch part of the glove packaging to keep everything sterile. So the only thing I can touch inside the glove is the inside of the glove for the first part. As I put the glove on. One glove came with me. Still sterile. Oh, it's fine. And then all I can touch is like this. Fix my fingers because my actual glove's sterile. So now that that's all done, I have a fenestrated drape as well, which I'm not going to use. So just throw that out for now. So the next thing I have here is a beta providine iodine solution. So what I would do with this is I would open and pour it over my cotton balls, throw that away. Then I have my lubricant, which, actually, before, put that back, that's still sterile. We're gonna toss out, there's no doctor's orders for a specimen collection, so we'll throw that out. Did not expect it to do that. So then I would take out my lubricant, put it into my, was there a cap? Oh, there's a cap. Take the cap off. Let me put a little bit in. Empty out my lubricants into the tray. Throw that out. And then I can remove this part onto the sterile field, so move this a little bit, keeping it outside the 1 inch edge. So then, since this has a blue cap, so we'll remove this. Remove the blue cover from the, throw it away, keep it inside here for now to keep it sterile. So that's all done, and then I would take this, remove the cap, and insert it into here. Okay, so that's all ready. So next thing I would do is I've set up all my equipment, so the next thing I would do is, with the patient, I would spread the labia open, and then take my iodine covered things, and then do one side of the inner labia, throw that away, get another one, if I can grab it, do the other inner labia, throw that one away, and then the middle, down the middle, and throw that away along with the forceps, because we're done with that. So the next thing I would do, keep the labia spread open with my now contaminated hand. I would then take this and move it towards the patient, moving all this because it's still sterile. So then what I would do is take the catheter and lube it up and then start my insertion. So into the urethra, and do not touch any other part of the contaminated glove until I see urine. So I would see urine here. I would keep going a little bit forward and then pinch it off here. Take this and push all 10 millimeters into the balloon. Okay, so keeping my hand on the plunger, I'm now done with the sterile portion of this. So it's in. I tug on it a little bit just to make sure that it's in. Take this out, keeping my hand on the plunger, and then toss that away. And then this is where I would attach this portion of the catheter with an anchor point onto the inner thigh of the female's leg, and give it a little room so that when she moves it doesn't pull on it. And then I would have the bag hang down below the waist on somewhere that wouldn't move. And then that is the insertion portion of this. Then to remove the catheter, you would then empty the bag first. That way it doesn't pull when you're on there. Get a clean 10 millimeter syringe, put it back in where you first, and then pull out. Let it fill. Keep pulling out. Let it fill until you see air bubbles. When you see air bubbles, that means all the water is out. You can then set that down, grab this, tell your patient to take a deep breath, and you just pull it out. And then dispose of it in proper way according to your facility's rules. Do a little bit of peri-care to clean off any extra lubricant or any other things that you've put on the patient. Remove your gloves. Throw them away. Perform hand hygiene. Ask the patient if they need anything else, if they can get to anything. Make sure the call light's in their position. Lower the bed. And you would raise the bed during the beginning of this. I forgot about that. But you would raise the bed before doing any of this, and then at the end you would lower the bed. Thank the patient, and make sure the call light's within reach.